Systemic racism is a term that is frequently heard in contemporary media. The police force is an organization that is commonly chastised for racial disparity. However, there is also a belief that systemic racism is intertwined within the healthcare system. People put their lives and well-being at medical professionals' hands in the hope of finding relief from physical or psychological ailments. To suspect that treatment is conditioned to racial bias is a deplorable notion that must be investigated and corrected. Hypothesis: African Americans receive reduced treatments in healthcare facilities compared to their Caucasian counterparts. Research question: how are African Americans treated differently in the healthcare system? It is difficult to refute that racism exists in the United States. There is evidence in daily microaggressions and vulgar displays of racially charged opinions in the comment sections of online news platforms. Racism can be defined as an organized system of oppression by categorizing social groups that establish inferiority through stereotypes, prejudice, and discrimination. One place in which all people should be sheltered from racial bias is at a medical center. In one article, researcher Sharon Parsons provides an archival study to examine medical treatment disparity against the African American community. She develops a convincing argument from numerous sources that systemic racism exists in the healthcare systems of the United States. Dr. Parsons likely used the grounded theory approach with her research. Grounded theory uses inductive reasoning to construct theories through procedural gathering and assessment of information. The second article focuses on attitudes of healthcare providers towards African Americans. The authors, Burgess et al., used the qualitative narrative approach to interview select providers. By doing so, they obtained useful information regarding healthcare providers' perspectives on disparities between minority patients and their Caucasian counterparts. The narrative analysis approach gathered stories from participants as a unit of analysis. The open-ended questions created a conflicting phenomenon. Healthcare providers asserted the disparity of treatment was due to patient-level factors. In other words, providers attest that it is not the characteristic of race that caused unequal treatment, but the behavior of the patients themselves. The previous two studies produced conflicting results. To alleviate the inconsistent data, a mixed methods approach will be proposed. An explanatory sequential design will collect quantifiable data from patients to measure the amount of perceived racial bias from medical staff and continue with interviews to enrich the information. A survey will be provided to patients as they are discharged from the medical facility to identify potential participants for the qualitative portion of the study. Patients who expressed unequal treatment through the survey will be asked to return for the interview. The interview will probe for perceived causation of the unfair treatment. The providers of those who felt biased treatment should be interviewed as well to assess their perspective of the interaction. Guidelines on obtaining informed consent for research can be found in Section 8.02 of the American Psychological Association's Ethical Principles and Code of Conduct. Consent is required for both the questionnaire and the interviews. Because the nature of the study is controversial and potentially condemnatory, it is necessary to assure that confidentiality will be provided according to Section 4 of the APA. These issues will be addressed by keeping the participants' files anonymous. Different research studies have produced conflicting results regarding racial bias in healthcare. It is important to identify contradictory information and expand on the events leading to the perceived disparity. A mixed method explanatory sequential design will collect data from patients who felt unequal treatment at a medical visit. Interviews will allow the participants to expand on their experience and provide unique insight from their worldview. Thank you very much. I hope you enjoyed the presentation.